One of the hallmark symptoms of Alzheimer's disease is that people often feel the need to just go home when they're disoriented and confused, and then become escape artists. The obvious and the most common solution has been to lock up the person in an Alzheimer's facility. But then that seems cruel and often aggravates an already panicking patient even more. As a result, the individuals try to leave their residences and wander away. When they wander away, it's a fiasco to try to locate them. Now, Radiolab's podcast details a remarkable story of how the Benrath Senior Center in Dusseldorf, Germany, found an alternative solution to protect its patients. It came up with the unique solution to install a bus stop. A fake one, that is. So instead of dissuading patients from heading to the public transportation exit, they actually built a public transportation exit on the premises. Whenever they're yearning to go home, the patients can walk right up to the stop in front of the clinic. When they've settled there and wait for their ride, which of course won't arrive, staff at the senior center have the opportunity to engage in conversation and soothe them back inside. Staff will approach them and say that the bus is coming later and then invite them in for coffee. As the time passes, the patient's urgency to return home dissipates. 5 minutes later, they've completely forgotten why they left. The seniors even tend to get lulled by the wait for the bus, and they often flash back from their imagined past and snap back into the present. That single idea has since changed care at the senior center. The nurses now lead patients back from other worlds by allowing them to explore the idea of the bus coming, rather than trying to convince them otherwise. The idea is being rolled out at half a dozen centers around Germany, such as in Munich and Hamburg, and throughout Europe as well. German nursing homes have been doing this practice since 2008. Check out the full story in Radiolabs. It's so emotional. It's such a sweet story. This practice has not been rolled out in the US and has been seen as controversial because it's seen as lying to the patient, that the lie is a hindrance to care. But is that true? I'm not familiar with dementia and the standard of care, but I imagine lying to avert a missing person is the lesser of two evils. Opponents of this practice say that they are being taken advantage of in this fake bus stop illusion. Debunking this deception may cause distress to a person with dementia. Hence, this raises the question whether building fake bus stops thoughtlessly could cause more harm than benefit. So it's seen as an ethical concern in the United States. This is an ethical concern, but I did a previous video about the astronomical cost for nursing home care, which average about $6,000 to $9,000 a month. The owners and the investors of nursing home have been paying themselves millions of dollars a year, as well as their families, owning affiliated companies that pay themselves, though that's not seen as an ethical concern. But building a fake bus stop to avert elderly patients from going missing is. Let me know your thoughts about this in the comment section. So if you had a loved one that was staying in a nursing home, would you mind that if the nursing home had the idea of installing a bus stop to prevent your loved one from leaving the facility, them having to do a missing person search? What do you think about this? Or do you think it's a compassionate practice, a humane practice, giving the patient some level of dignity and even independence, that they have the volition to travel home by means of this fake bus stop scenario? Let me know your thoughts in the comment section. And also, don't forget to check out my other video that does a deep dive into a nursing home in New York and how they have been draining resources to pay the owners and the owners' families instead of investing that money in the infrastructure of the nursing home. So don't forget to check out that video. And let me know your thoughts about these practices in Europe and in Germany. Or do you think this is a harmless practice and it does more harm than good? Or do you think it could be harmful to dementia and Alzheimer's patients? Or do you think it's a good practice that should be rolled out? Let me know in the comment sections, and I will see you next time. And please don't forget to like and subscribe, which share with anyone else that you think will find value. And I'll see you next time. Bye-bye.